Are you interested in becoming a registered nurse in Canada? Nursing is one of the most in-demand and rewarding careers in the country. In this video, I'll walk you through everything you need to know, from education requirements to licensing and finding your first nursing job. First step to becoming a registered nurse in Canada is getting the right education. Depending on where you live in Canada, there are a few different pathways to becoming a nurse. The most common ones are completing either a Bachelor of Science in Nursing BSN, a Registered Nursing RN diploma, or, for internationally educated nurses, bridging programs. Most provinces and territories in Canada require a BSN as the minimum education to become an RN. This is a 4-year degree program offered at many universities across Canada. In 2023, more than 75% of new nurses in Canada were BSN graduates, according to the Canadian Nurses Association. Some colleges offer registered nursing diplomas, which take about 2 to 3 years to complete. However, this path is becoming less common in some provinces, as most are moving towards the BSN requirement. If you're an internationally educated nurse, you may need to complete a bridging program to meet Canadian standards. These programs are designed to fill gaps in knowledge and ensure you're ready to work as a nurse in Canada. Once you've completed your nursing education, the next step is to pass the NCLEX-RN exam. This exam is required by all Canadian provinces and territories to ensure that you meet the standards to practice as a registered nurse. The NCLEX-RN is a computerized adaptive test that evaluates your ability to make critical decisions as a nurse. It's designed to test your knowledge in areas like patient care, nursing fundamentals, pharmacology, and safety. Many nursing graduates spend several months preparing for the exam using practice tests, review courses, and study guides. Make sure to use resources like UWorld, Kaplan, or NCLEX-RN prep books to help you succeed. The NCLEX-RN costs around $360 Canadian to take, and if you don't pass on your first attempt, you can retake it after 45 days. After passing the NCLEX-RN, you need to apply for licensure with the nursing regulatory body in your province or territory. This step ensures that you meet the legal requirements to practice as a registered nurse in Canada. Each province has its own nursing regulatory body that issues licenses to nurses. For example, in Ontario, you'll apply with the College of Nurses of Ontario, while in British Columbia, you'll apply with the British Columbia College of Nurses and Midwives. You'll need to submit your NCLEX-RN results, proof of education, and any additional documentation, like a criminal record check or language proficiency test if applicable. The fees for nursing licensure vary by province, but typically range from $300 to $600 Canadian dollars. Once you've obtained your nursing license, you can officially start working as a registered nurse in Canada. This is where the real journey begins, gaining practical experience in healthcare settings. As a new graduate, most nurses start in entry-level positions in hospitals, long-term care facilities, or community health settings. Common entry-level roles include working in medical surgical units, pediatrics, or long-term care. Many hospitals in Canada offer new graduate programs or internships designed to help you transition smoothly into the workforce. These programs often provide additional training and mentorship. If you're interested in advancing your career, many nurses go on to specialize in areas like critical care, neonatal nursing, or emergency nursing. Specializing often requires additional certifications and continuing education. With a nursing license and some experience under your belt, it's time to explore job opportunities in the nursing field. The demand for nurses is high across the country, particularly in rural and remote areas. Nursing is one of the fastest-growing professions in Canada, with an aging population and increased demand for healthcare services. The Canadian Nurses Association projects that Canada will need over 60,000 more nurses by 2025. You can find job postings on healthcare job boards like Healthforce Ontario, Workopolis, and Indeed, or by applying directly to hospitals and healthcare networks. The average salary for registered nurses in Canada ranges from 65,000 to 85,000 Canadian dollars per year, depending on the province and level of experience. Many healthcare employers also offer benefits like pension plans, paid vacation, and professional development opportunities. And there you have it. Becoming a registered nurse in Canada takes dedication, but it's a highly rewarding career with plenty of opportunities. Start by getting the right education, passing the NCLEX-RN exam, and gaining hands-on experience in the field. If you found this video helpful, don't forget to hit the like button and subscribe for more career tips and advice. Comment below if you're already on your journey to becoming a nurse or if you have any questions.